Okay. So we are now streaming live on YouTube.
Yes.
Okay, so we will convene a meeting. This is the meeting of the Senior Issues, Housing, Health, and Welfare Committee of Community Board 10 in Brooklyn, January 14th, and we're at 7:07. So thank you all for joining us this evening. We have a very important issue, one that there's tremendous interest in and really looking for a lot of direction on. So we have some terrific guests this evening that will be presenting. What I do want to do is go over the format before we get started. As with all community board meetings, but particularly one of this size, we want to adhere to sort of the rules of presentation. So generally what we will do is we will have the presenters following the agenda, and we will not interrupt for questions. At the end of the presentations, the board members will ask their questions. After the board members have asked their questions, everyone from the community will have an opportunity to do so as well. Okay? All right. We have representatives from NYU. We also, which I will allow to introduce themselves. I also want to acknowledge we have Monique Chandler Waterman, Brooklyn Borough Outreach Director, Department of Health. Anna Schatz, she's New York City Health. Barbara Williams, Test and Trace Corps. And Todd Fleetner, he's the Deputy Executive Director of our local Bay Ridge Center. I want to first introduce Sarah Osterlarza. And Sarah is with Government Relations at NYU Langone, and her colleague, Hannah Wade. So both are from NYU Langone, and they're going to start our presentations, and then I invite you to follow. Okay.
We're also joined, Iris, by Marianne Nicolosi from Bay Ridge Center. I saw her come on. I just wanted to mention that as well.
I didn't see her. There, hey, Marianne. Okay. So Sarah and Hannah, I know there are other representatives from NYU, and if you would please do the honors of introducing them, I would appreciate that.
Hi, good evening. My name is Sarah Osterlarza. I work for NYU's Government and Community Affairs Department, and we're so humbled for this presentation today, allowing us to have this important presentation and this important talk. But actually, I now hand the floor to the doctors and have them introduce themselves and give a little background as to what they do within the health system.
Okay. Hi, my name is Lalita Parameswaran. I'm one of the doctors who will be doing the presentation today. So I'm going to first share my screen. I just want to confirm you're able to see the title screen, which should say NYU Grossman School of Medicine. Is that what you're saying? Okay. Yeah. It's blue background. Just want to be sure you're all following along. Okay, so I belong to the NYU Langone hospital system. I'm an infectious disease doctor, and I'm a co-lead for the NYU Langone Brooklyn Vaccine Center, which was established for the purpose of COVID vaccine trials. Along with me on this call are our ops manager, Akeem Moore, and one of our nurse practitioners, Kelly Minus, and we will together be taking all the questions. So first of all, I'd like to thank everybody here for allowing me to do this presentation. And I'm hoping that I would be of some help to you. And also we, as a group, would love to hear what questions you have about this new vaccines that are going out into the community. And we're hoping to allay any concerns and provide some sort of guidance if that is desired. So moving on to the next slide, this is a slide from Google, and we are in a pandemic, and we are currently seeing a surge from November onwards. As you see, the cases are rising, and what is hopeful about this stage compared to where we were in March and April was that there seems to be some hope in the form of vaccines and better therapeutics to show us sort of a light at the end of a very long tunnel. And we're all of the hope that 2021 turns out to be much better than 2020 has been. I also want to give a shout out to all the New Yorkers who've been here through the pandemic and supporting us, clapping for us. We deeply appreciate those acts of, appreciation that really keeps us going as, things get sort of feels like almost as though you're in a loop, but it really keeps us going. So very much appreciated by, my colleagues, and I speak for all the healthcare workers who are working in the hospital. So common symptoms of the COVID-19 illness. About 1 year ago, most of us didn't even know that this virus existed. And now we seem to be so familiar with its symptoms that it's sort of percolated into our consciousness. So much over the last year. So common symptoms are fever, cough, and difficulty breathing. The vast majority of people appear to have these type of symptoms. The incubation period, or what we call the latency period, these symptoms may show up anytime between 2 days after exposure to about 14 days after you've been exposed to the virus. So it's a very long period. And during this period, you may actually not have any type of symptoms. And that's what makes this disease so challenging to control, is that during this time, when you're not feeling a lot of symptoms, you may actually be transmitting the disease to other people. So it seems to be a silent spreader of, infection. And that is what is, hard to control about this disease. So how does the SARS coronavirus 2 actually spread? So the most common modes of spread are through the nose and through the mouth in the form of droplets. So droplets are basically things that come out of our mouth when we sneeze or cough, and then another person either inhales them or it sits on their mouth, nose, and eyes, what I call the T-zone, and enters through that route. Other ways that the coronavirus spreads, especially indoors, is just through even more tiny little droplets called aerosols. And this is how a person who sits far away from you without wearing a mask may be able to get the disease, especially in an indoor situation. A lot of the guidance around how to prevent yourself from getting this illness is structured around the way it spreads. So since most of this intake of the virus is through the nose and the mouth, the guidance for wearing a mask and using hand hygiene has basically gone out. So these droplets can also fall on other surfaces and can remain. And when you touch the other surfaces and touch your eye or your nose or your mouth, the virus can get inside your respiratory tract that way. So the important part also about COVID-19 is that it is not affecting everybody equally. So New York went through a huge change in March and April and went in a lockdown situation. And we saw that COVID-19 basically affected disproportionately certain groups of people who were unable to socially isolate themselves. So people of color, essential workers, hospital workers, people who work in grocery stores, people who work in transportation, security, they all had to go out and do their jobs. So COVID-19 is a little bit of a social illness as well, in the sense that it disproportionately affects certain groups of people who are overrepresented in the essential services industries. The other vulnerable group, and what I'm hoping is very pertinent to this presentation, are older adults. So older adults often have waning immune systems. So over years, our immune systems are best when we are younger in life and often wanes over the age for many diseases. So it's not much different for COVID-19 as well. Older adults are sometimes more likely to live in group situations, such as nursing homes, and they often have many comorbidities. So the virus seems to have an increased, what we call a morbidity, meaning increased hospitalization, increased seriousness of illness in this group of adults. And then other groups that are affected are people who have lower wage jobs, no health insurance, and no options to work from home. And then residential segregation, such as high housing density, multi-generational households with limited space, and then lack of ventilation. All of these things are risk factors for increased spread and affection in these type of communities. Now, what can a SARS coronavirus vaccine do? So the whole reason we all are in this situation where a vaccine is being offered to us is in order for us to get our lives back, basically. So a vaccine can benefit the individual, but more in a sort of broader sense, the vaccine can benefit the community. But in the individual basis, it can absolutely reduce the severity of illness and also prevent the infection. Those are the two core tenets of a vaccination program. On a broader sort of umbrella, what is the benefit to the community is these individuals who are vaccinated will hopefully not be spreading the disease to others who are perhaps not fully vaccinated or have contraindications to the vaccine and didn't get vaccinated. And in that sense, it halts the transmission and builds a healthier community so that all of us can return back to our lives, which are sort of in a limbo right now. How does a vaccine work? So a vaccine is sort of almost like an alarm system. So when we introduce something in the vaccine, what we are actually doing is showing the body that there is something here that's not your own, and then the body raises its alarm. How the body does that is it raises its alarm through a group of cells called the white blood cells, or your immune system, which protects you against any number of pathogens on a daily basis. And once the body sounds this alarm, the immune cells go in, attack the virus, and then kill the virus or block the virus from further multiplying in your body and creating disease. That's the whole physiology of how vaccines work. And that's the same principle that's been around for almost all of the vaccines. And the COVID-19 vaccine is really no different in this particular principle. Now, will the COVID-19 vaccine itself cause the COVID-19 illness? No, the vaccines that are being tested do not have the whole virus. So they have small portions of the virus. Now, just like this particular graphic shows you, if you just give something a tire or the handle, it doesn't make the whole cycle. Very similarly, if you give small bits of what we call RNA of the virus, introduce it into your body, then that is not going to produce the whole coronavirus. So there is no risk of getting a coronavirus infection from the vaccine itself. So you cannot have COVID-19 illness occur due to the vaccine. So why do we need a vaccine? We often think about this in sort of a deeper method. So one is, like I said, on the individual basis, we need to reduce the death and serious disease as much as possible. So the current death rates are almost about 4,000 people are dying per day. And right now, COVID-19 is the third most common cause of death. So there's an enormous number of people whose lives have been irreversibly changed due to this disease in a span of 1 year. So, this cannot continue as a society. It's very difficult to preserve a functioning society with this level of illness. And then already there are a lot of people facing disparities, economic, financial, housing. And this disease really has changed the world for many of our population and many of the people in New York City in various different ways. And then how do we get back to our life? How do we go hugging our kids, and how do we go hugging our older, grandfathers and grandmothers? So we do need to get our life back. And one of the ways that we can do this, and it's been done in history too, is to have a vaccine. I wanted to show this slide because these are diseases that we don't see anymore. And these are diseases largely eliminated by vaccination programs. And this is diphtheria, where a vaccine was introduced in the 1920s. It's almost non-existent. I have never seen a case of diphtheria ever. And then there's polio, which has almost been eliminated in vast majority of the world, again, due to a vaccine program. And measles, though we did have a little resurgence of measles, but for most part, it has been eliminated. And these are all due to successful vaccination programs. So what is going on right now has precedent in history as well with other pandemics at different points in time. Now, what we try to do in NYU Langone is to protect and restore human health through vaccine research. So NYU Langone's Brooklyn Vaccine Center belongs to the umbrella of vaccine education and treatment units. There are 10 such across the United States. And it was started by our PI, Dr. Mulligan. And he decided to establish a center at NYU Langone, Brooklyn, because we wanted to help our community. We wanted our community to be a part of this research. And we wanted to offer this as an option for our community and serve as a source of education and dispel some myths if possible. And that is sort of our mission, and that's sort of our mission for our entire center as well. We have been enrolling for COVID-19 vaccine. We just recently almost completed enrollment for a phase 3 vaccine trial. However, there are more vaccination trials upcoming. And if you are interested, especially people with underlying medical conditions, people with greater chances of exposure to the job, and you're interested in COVID-19 research, then there are 4 locations in Manhattan, Long Island, Sunset Park, as well as Bellevue Hospital and VA. These are our sort of 5 total locations. The main location is Manhattan. The others are satellites. We would love to have you join in our research. We're also planning to do other types of research, not just vaccine research, but also vaccine hesitancy, vaccine uptake, and things like that. So we would be very interested to have the community's input into all of our research endeavors. Where we are located is we are located right across from the Brooklyn Hospital in what was previously called the Augustana Medical Center. The second floor of Augustana has been repurposed into a vaccine research center. And this is a quick snapshot of our team. We are a larger team than this. Some of the team members are missing in this snapshot. It was taken in a very quick manner. So we have several data analysts, some nurse practitioners, and research nurses as a part of our team. We are really here to be more of a resource for the community because vaccines themselves don't save lives. It's only when you get vaccinated that lives are saved. And the participation and support of community is very essential. I wanted to also show this. I know the Department of Health is there on this call, but online, I was trying to help several of my neighbors book appointments. And I found the 1877 VAX for NYC number quite useful. In fact, possibly more useful than the NYC Vaccine Finder. And we can answer more questions related to that. But I wanted to project that number because it's quite easy to remember. And instead of struggling with the internet, sometimes it's easier to call. There may be a longer wait time, but at least there's a phone number. And this slide shows the New York City Smallpox Hospital. And again, this is one of the other diseases that was eliminated because of a vaccination program. Hopefully one day the COVID-19 will also reach such an end. This is in Roosevelt Island. I've personally never visited it, but it is there for visiting. I wanted to thank everybody for listening to me, and I'm happy to answer any questions related to our work or in general COVID-19 vaccines.
Thank you, Doctor. Excellent
I
presentation.
have a question.
So what I'd like to do now is I will open it up to questions from board members. And so you can unmute yourself and ask a question. All right, now I have my large screen. I can see everyone.
I have a question.
Okay, sure, Julie, go ahead.
Okay, so my husband happens to be 65 years, actually he's older than 65. I'm not, but he is. And I'm wondering, do you have an idea of when and where and how, people, how is it going to be categorized? Who's going to be able to get, obviously after the healthcare workers first. Do you have an idea of when that group of people who are, also my husband has diabetes too, when would people of that ilk be able to get the vaccine? Do you have any idea?
Julie,
So,
can I
yeah,
just
go-
jump in here, Doctor?
Yeah, of course.
Every day we're getting more information, and we do have representatives from the Department of Health and Test and Trace, and I know they will be speaking to those issues. So if we could just hold off a little bit.
Okay, I wasn't sure who the right person is
But
to
no,
ask. So.
and it's absolutely what's on everybody's mind. So
Right, so I
give
figured
a lot
I'd be
of
the
time
first
for that.
person to ask it.
What I would like to do is to invite if there are any questions or thoughts about the
Okay.
doctor's presentation.
Yeah, and also we could use the hand raise feature, so it's a little bit easier to just keep track of anyone who wants
Judy, I
to.
see you though.
I have.
Judy?
Yes, for your program, you're encouraging registration, but I'm not clear if I register, what is my responsibility and what is the benefit to me? So I don't, so I'm registering, am I registering to be tested as using the vaccine? Could you explain?
So I think I just want to paraphrase. You're talking about registering in the vaccine trial registry, right? That I have projected right now. Yes. So when you put your name on, say you scan the QR code and you enter into their registry, you are essentially indicating your interest in being a participant in the vaccine trial. But you don't automatically get enrolled because we have, sort of instructions as to whom to enroll and who would be good vaccine trial candidates. So you'll be asked to go through a series of questions, what is called pre-screening. And they're mostly to make sure that you would do well in a vaccine trial situation. So that is currently what the registry is used for. It may, like I said, as we do more research projects, there may be more things you could register for down the line. Yeah.
And so the only benefit to me then would be the altruistic support for the research. But would I be actually getting the vaccine, the standard one, or is it another experimental vaccine?
Yeah, so the research is going on right now, not with the approved ones. I mean, NYU was a part of the Pfizer research trial, but right now Pfizer and Moderna are both approved for, population. What we are doing research is purely research, which means we are testing out, like you said, testing out newer candidates, because what we do realize is with the supply we have and the kind of accelerated sort of pandemic, it's growing out of control in most places in the United States. We may need more than one or two vaccine candidates. So we have to keep continuing our research. It's also possible that there is an amazing vaccine candidate out there and we would need to discover it, just like the multiple versions of flu vaccines that we have every year. So the research trial is what we are doing right now. We don't administer the approved COVID vaccine. And if you scan the research code, you would be going into the research trials registry.
Okay, thank you. Again,
Yep.
first
Josephine.
starting with, this is just for board members. Joseph,
Yes, it's
I
Joe.
heard your voice. Yes, Joseph.
I have a question for the doctor. Is it true that it takes 6 weeks for the vaccine to actually protect you, that you're still vulnerable to the virus for 6 weeks after you get the vaccine?
So, for any immune system sort of to activate, it does take some time for your body to build those proteins. When you introduce something, you remember the slide where I said it's a warning sign, that there's something foreign, and then your body sort of activates. So yes, it does take time. And during that time, yes, you are vulnerable to the infection. which is why as soon as you get your vaccine, I wish I could say, oh yeah, let's take off our mask and walk around. That's not true. It'll take your body some time to produce these cells that will defend you from the infection. How long it takes is an interesting question. And the way the vaccine trials did the study was they took 2 weeks after the vaccination and they counted the cases afterwards. So they gave 2 weeks for your body basically to, mount sort of a response to fight the infection. So after that, they started counting the cases. And they also used 2 shots. So it's 2 shots and then 2 weeks after. So I guess that's where your 6 weeks comes in, because for most of the vaccines, it takes that much time to consider yourself, defendable or, where you can defend yourself against a virus. So yes, I don't know about the 6 weeks exactly, but it does take time, at least a couple of weeks after the vaccine.
Thank
The
you
full
very much,
vaccine
Doctor.
series. Yeah.
Jill, I
Thank
know
you.
you've been waiting patiently. Jill?
Thank you so much. So being that this is a senior issues committee from the start, I'd just like to speak to the fact of seniors not having the ability to have access to maybe the computers online. And I know that the doctor said that there might be some long wait times for phone calls. I mean, my mom is 85. It took us a very long time to get her an appointment, and she had daughters that were computer savvy. She also is a very patient woman and was on the phone for a very long time. But she tells me of a lot of her friends who don't have access to people to help and don't have access to computers. I'm just wondering, and my mom has my chart, thank God for NYU. But I was just wondering if there, the larger community out there who doesn't have all these people to help or access to the internet, maybe can you hire more people to answer phones? It is a very long wait time, and our elderly does get frustrated very easily. So I would like for the doctor to speak to that and maybe help out our community, or maybe our community center could help people register or make appointments. So yeah.
All right, Jill, what I want to say is the doctor's been really involved in the research end. We have representatives from the Department of Health, Test and Trace, and this is what we want to talk to them about. So we're going to move to their presentations next.
Okay, thank you.
Okay, thank you. I know it's a real urgent need and there are lots of problems. So any other board members first regarding the doctor's presentation? And I'm flipping over my other screen just to make sure. Okay, anyone Stephanie, did you want to say something? No? Okay. And anyone from the community specific to the doctor's presentation? If not, we'll move forward. Okay.
There were some
Feel free.
questions which were emailed. Do you want me to quickly answer those? Yeah.
Were these emailed specific to your needs? If they're more generalized, I would prefer that we have the other presentations and then address it all, if you can stay with us.
Okay.
I had my hand raised. I just have a question. If you go into one of the test experiments, then you should not get the COVID regular vaccines that are available now. Is that correct?
So what you're saying is if you become a trial participant, for example, and then say you want to get, the Pfizer or the Moderna vaccine, what is the process? Yes, we do have a process for that. The company has given us the option to present you with whether, there's a process where you find out what you got. And then depending on that, decide whether you want to stay as a trial participant or receive the, the approved vaccine. So there's a little bit of a workaround, and most of the companies have realized that this is a unique situation where there is a pandemic going on. There are some approved vaccines and people have very valid questions related to that. So we absolutely have a process in place, and we've been actually using it for many of the community, the trial participants. Depending on what your exact situation is, we can help with that.
Okay.
And I think before we move on to that point, each vaccine that's out now was 100% in the trial phase, as AstraZeneca is now. Dr. Paramis-Wan and I both worked on the Pfizer trial together, and then when that got far enough, we moved on to AstraZeneca, and we also plan to, once that moves far enough on, move on to the next COVID vaccine, because we do need a multitude of different vaccines to have enough to vaccinate everyone. So to the benefit of the trial is, before any vaccine became widely acceptable or had EUA approval, the only chance at protection, whether it be a 50-50 chance or a 2-to-1 chance, was with vaccines, was with the vaccine trials. So we do want to just remind everyone that now the vaccine is widely available to most people. There will be a wait. There's people here in New York City who all need and should be vaccinated. But a lot of times your best chance, especially, to kind of prioritize yourself, would be to get involved with the vaccine trial. We are using vaccines that do run the chance of becoming approved in the next couple of weeks or next couple of months. But the goal here is to test them all, get the efficacy, find the answers to your questions. Does it take 6 weeks to work? How long do antibodies last? That's what we're doing here. So we would, recommend and encourage you all to still take part in that and other vaccine trials as we move forward.
Thank you. Thank you. Are you affiliated with the Department of Health?
I'm with NYU.
Oh, that's Akeem. He's our ops manager.
Okay, he's very knowledgeable. Thank you
Yes.
so much.
Yes, he has really run the show. And what he said is very true. We don't have enough supply. I honestly think that people are not able to make appointments because we need to get supply of the vaccine in order to get you an appointment. And the rate the supply is going, we probably need three or four vaccine candidates probably. That's why we are still continuing our research, in spite of there being 2 approved vaccines already. And again, the research is purely voluntary. So anybody, if you feel you read through it and it's not for you, no one's going to force you to take part in it. It's absolutely voluntary.
All right. Well, thank you. So if there are no further questions at this time, I'd like to move to our other guests this evening. I don't think there are formal presentations, so we can introduce all of them, and then they can speak to the issues I know that we're eager to get to as well. So I want to say tonight we have Monique Chandler Waterman. Monique is the Brooklyn Borough Outreach Director for Test and Trace Corps. And with her is her colleague, Barbara Williams. We also have Anna Schatz from the New York City Department of Health, and Todd Fleetner, who's the Bay Ridge Center Deputy Executive Director. So my understanding is anybody does not have a formal presentation. So I allow you to speak to sort of the general issues and what you represent. And then again, we'll follow the format of taking questions from the board and then taking questions from the community. I also have some written questions from that were set ahead of time, and I'll share those with you when we get to that place in our meeting.
Got it. Hi, everyone. This is Anna Schatz from the Department of Health. We do have a slideshow that I'm hoping I can project, and just wanted to do a little edit. I am joined here today by Teresa Darty from Test and Trace, and I'm going to let her introduce herself as well.
Okay.
Good evening. My apologies. Today's Monique's birthday, so I did make sure that she had the evening off. She's on our team. I'm Teresa Darty, Deputy Director of the New York City Test and Trace Corps Outreach Campaign. So our team's work is to continue the direct with community engagement. We do in-person work as well as virtual work as this. And so our work is to make sure that information and resources are accessible and that we're bringing back the community's needs and inputs to continuously improve and build the Test and Trace program. So I will turn it back over to Anna.
Terrific. Thank you.
Perfect. And I just shared my screen for the slide deck. Can you see the slide deck, the correct view of it?
Yes.
Yes.
Perfect. So just going to go through a brief update. We just had a wonderful presentation on all of the things that are COVID-19, the science about, behind it. I just want to, for sake of time, I'm not going to spend too much time on it. But again, thank you so much for having us here today, for inviting us over here. We will try to answer as many questions as we can and take back whatever we don't have answers for. But just over here, we have all of this information on our website, on the data page on the COVID-19 website. This shows the 7-day % positivity for COVID-19 cases, and the darker the red, the more cases there are. And so as we see on the right over here as well, since about October, we are seeing an increase in our data. And we go on to the chart here where we are comparing the peak of the pandemic in the beginning days in March and April. We see a very steep increase in cases. And then we were doing well over the summer months, and right now we're seeing this climb up here, but we see that it's a little bit more choppy, which is showing us that the things that we're doing in terms of core 4, following all of the directions is working. And if we look at more of a 7-day positivity in Brooklyn, since October, we see that these little spikes are happening right after like the Thanksgiving holidays, and then after the Christmas and the New Year's, we have that bump happening over here. And then when we see that little decline, that's also showing that the data is still coming in, so it's not totally accurate of a decline yet. I'm going to pass this over to Teresa.
As I mentioned, the test and trace outreach teams, our focus is to continue to be out in communities. You might see our canvassers or our outreach teams in public parks, in green markets. We're partnering with many community organizations, particularly in Brooklyn, such as those that you see here. We're partnering with tenant associations, mutual aid groups, block associations, civic groups. Our goal is to make sure that we are getting resources that we can out there, such as free face coverings and free PPE when they are available. And our goal is to continue to put the word out there about, as everyone who's presented before us mentioned, even though the vaccine is getting us on the road to a longer term recovery, our fight for basic COVID prevention is not yet over. And so our goal in all of our street and community outreach is to continue to hone the message of our core 4 that everyone has a responsibility for basic COVID prevention, wear a face covering, remain physical distant, wash your hands, and of course wear face coverings. And so we're certainly continuing to put that out there. And as the information about the vaccine program rolls out, all of our street and outreach teams will also be putting that information out there. And so you see here, this is just a sampling. Just in the past week, we've distributed over 116,000 masks in Brooklyn through events with community partners or direct on the street engagement.
Perfect. And just to reiterate the message that we've been saying and what Teresa just said as well, the things that we can do to stop the spread is to get tested by, finding a location at 212 COVID-19, following the core 4 of staying home if we're sick, and if we recently traveled, have been in close contact with someone who has had COVID-19, wearing face covering, keeping socially distanced, washing our hands, using hand sanitizer, avoiding travel and gatherings, as the data is showing us those bumps around the times of gatherings. And the commissioner's advisory came out for older New Yorkers, basically stating that anyone who has underlying health conditions, they are in the more vulnerable group and they need to follow these the core principles, but at the same time, for anyone who is a household member of those folks, need to also be just as vigilant to make sure that they're following all of the guidelines as well. And just to take us into the conversation of vaccines, this is our campaign, Vaccine for All, New York City Vaccine for All. And we want to, stress that it is safe, free, and easy to get vaccinated. We are working with state and federal partners in rolling out this vaccine and making sure folk are getting it. Hearing the frustration all through, this meeting and in general that there are long wait lines, and in terms of like the phone calls and getting appointments, I just want to be super transparent that we don't have, we have less vaccines than there are people that are eligible for it. And therefore, it's going to be a bit of a push to get this into a smooth wave of getting everybody vaccinated. But we do want to focus on our equitable distribution, including acknowledging history, current experiences of racism and bias in medicine. And want to acknowledge that, this is something that we need to be mindful of, and we are partnering with community partners, elected and city agencies, and other sector partners to make sure that we are driving our work through an equitable lens. So we have a vaccine command center, which is basically a multi-agency approach. It's the health department, partners at health and hospitals, emergency management, racial inclusion, and equity task force is working with us as well. And we're doing everything we can to procure and distribute vaccines throughout New York City in accordance with the federal and state guidance. State is the one that is giving us the directive in terms of who is eligible. So we do have to follow it, and the federal government is giving us the supply. So, we need to execute the comprehensive community engagement and outreach, and with an emphasis on equity, monitor our data. That data is being posted onto the Department of Health website. Under the data tab, there is a new link that says vaccines, where you can see how much we have in stock and how many of them have been administered, both for the first dose and the second dose, and educate New Yorkers with science-based information. So webinars like this, and relying on our community partners to also help us spread the message about vaccines. It is a phased distribution. Like I said earlier, state is the one that is determining how the groups are being prioritized and the timeline for distribution based on CDC guidance. And people at increased risk of getting COVID-19 or at increased risk of severe COVID-19 illness are being prioritized. So these are the current eligibility groups posted here. And if you go on the website that's on the bottom, you can get that full list as well. But for anyone that is dialed in and is not on the Zoom call, these are healthcare workers with patient contact, staff and residents of nursing homes and other long-term care facilities, medical examiners, coroners, and at-risk funeral workers, frontline public health workers with patient contact, those who are 65 years and older, and other high-risk essential workers such as teachers, childcare workers, first responders, correctional facility staff, public safety, public transit, and public-facing grocery store workers, and residents at and high-risk staff of group homeless shelters. And when will this vaccine be available for everyone? We're monitoring the supply. The supply is limited and does fluctuate on a daily basis. And we're thinking that mid this year, 2021, we will be able to have it available for everyone in New York City. And again, it has begun with the highest priority group based on what we've seen who have been the most impacted by COVID-19 in New York City with the virus, COVID-19 virus. And New York State is receiving the new shipments from federal government every week, and city is ensuring broad and equitable availability of the vaccine. To get vaccinated, so the city started opening vaccine sites for those who are eligible by appointment only. The appointments can be found at either the website or the number 877-VAX4NYC, which we heard about in the previous presentation, is to help those who do not have access to a computer. We do know there is a long wait line to get to talk to someone. And again, because there is a large amount of people that are, calling in to find out more information, and we're acknowledging it and working and doing our best to try to manage this issue. And depending on supply, at some point when it's more widely available, the vaccine can be received at the same places you get all of your other vaccines. So think about your flu shot. So all the same places where you get your flu shot, you might be able to get a COVID-19 vaccine. And so just keep checking the website regularly for more updates. And just going to end with, the things we can do right now is continue following the core 4 principles. And there's a fact sheet that is available on our website right now, and a new flyer. And we're just, for anyone who has received the vaccine, hoping that you share your message and your story on social media to help get those who might be reluctant to get the vaccine or isn't sure if they want to get the vaccine once it is available, so they can hear these stories in the meantime, and help us spread the word. So I'll open to questions now and try to answer as many as we can.
Thank you. I do want to invite board members first for this question period. Use the raise hand function or physically raise your hand if I see you, call on you. Okay, I'm going to open it up now to community.
Iris.
Yes.
It's Joe.
Uh-huh.
I just wanted to make a comment on that trace and check that they had. I think I'm muted. Hello?
We hear you. We hear you,
We
Joe.
hear-
Okay, I just wanted to say that I was under the trace and track for 2 weeks in the beginning of November, and they did an excellent job with me. I mean, they checked once a day. If they didn't get me at one point, they called a second time. They set me up a food delivery for 2 weeks, and they sent me a supply of masks and sanitizer and self-testing kits to mail in, and they were very, very helpful and supportive for 2 weeks.
Oh, thank you, Joe. Iris, we have Stephanie from Councilman.
Yes, I'm just going to get to Stephanie from Councilman Brannan's office.
Hi, can you hear me?
Yes.
Yes.
Right, so basically I have 2 questions. First one is there enough of the vaccine that's being distributed now for the first round? Is that since the same dosage for both vaccines, for both the first and second phase to get, is there enough to provide the 2 shots currently?
So in terms of the 2 shots, the way it works is when the supply is received for the first shot, it is automatically being ordered for the second shot to be available in the time frame that is needed for the second one to come in. So that supply is scheduled to come in for when that second shot is supposed to be given.
And then when they do go and they set up, because I've tried numerous times to help people with getting it appointments online and stuff, and it's updated almost every second. Some of the questions on it, one of them I know asks if you are allergic to any of the component of the vaccine, which is a little bit of like a misleading question since you really don't know what's in the vaccine. So you don't know if you're going to be allergic to it. So maybe that one might want to be taken off the questioning. I don't know. It's just a suggestion.
Yeah, no, that's thank you for like suggestions like this. Definitely writing them down. In terms of the ingredients, I'm going to drop it into the chat box. It's on the FDA website, and like the list. It's like a fact sheet for each of the vaccines, and it gives you the ingredients. So I'll just drop it in here for information purposes as well.
Thank you.
But as a follow-up to that, if it were somehow able to be connected to the question, so that as you're filling it out, you might be able to look at the list, we'll also look into that option.
Yeah, because I mean, it's like when you go and you get the flu shot, they ask you, are you allergic to eggs?
Eggs.
They know automatically, okay, yeah, I can't take this shot. So maybe there's the other shot, the other derivative of the flu shot that I can take.
All right, we have another question?
Yes, Anne Flutico.
I don't see Anne. She might be my.
Anne, you had your hand raised? Oh,
Yeah,
it's,
my question was about the second dose. Thank you.
Okay, great.
My hand is down.
Okay.
Just to clarify what the other woman said is that they're not reserving the second dose. They're assuming that they will get the second dose in time for the person to get the second shot, but that's not necessarily true if there's a delay.
I will follow up on the, if there's a delay situation on it, but the way it's like set up now is that order is automatically placed. And when you're getting your first vaccine shot, they're automatically also scheduling you for your second appointment on the spot as well.
Right, but you're not reserving the actual vaccination. You're not putting it or storing away saying, this is for that person. You're going to wait and hopefully get a resupply in.
Right, so let me clarify that it does or does not happen. And also I just wanted to know, there is no chat box here for me to drop it into. Sorry,
Oh.
I'll have to email it to you afterwards.
Okay. I don't know why that is, but that's odd. Thank you.
Okay. Then I'd like to just ask one question. When I saw you had a list of sites, and I know that was just a real partial list, I did see there was a senior center on there. I think it may have been in Bensonhurst. I know Sunset Park and the Brooklyn Army Terminal, there's a large vaccination site there. Are there any sites in Bay Ridge, Dyker Heights, and Fort Hamilton?
In terms of sites, we're continually looking at where existing testing sites have been, such as the Brooklyn Army Terminal, which was converted into a vaccination hub. We're looking at additional spaces also. You heard in the news, they'll be looking at, they're going to be setting up at Citi Field in addition, because they have to stay in the game. The Yankees have also offered their stadium as well. You can get a different kind of subway series going maybe. I'm from the Bronx, so I have to say that. But we are continuously looking. Certainly we're looking at particularly where the highest needs are, particularly for the age groups, the other high needs folks are, where we might need to put those locations. So there are constantly people going out there assessing sites. We're also willing to hear from our community leaders and our elected officials, many of whom have been making recommendations for us. And so as we are aware of when we are likely to receive more doses, that we can know how quickly to set up new sites, we're definitely assessing that, and we welcome your suggestions.
Thank you. I will say, if I may, Bay Ridge, or this community board, has the third largest concentration of older adults in the city of New York. So if we look about access, particularly for older adults, who may have a more difficult time traveling outside of the community, if you keep that in mind.
Definitely, and we've been meeting with DFTA as well to make sure that we are as aware of where the communities are, who are at the highest risk and who are in the largest eligibility groups, to make sure that as we're ready to open, we're going to be in as many of those best places as possible.
Fantastic, thank you.
Iris, Maria Nicolosi had her hand raised, and then Judy Grimaldi.
Marianne?
It's okay, Judy, go ahead. I'll do it later.
Oh, Judy, you're on mute.
Say the same thing that Iris had, is that, you know, we have such a high concentration of older persons, and yet there's no site in our community board district at all that I know of. Am I wrong, Josephine? Is there a site?
There are some smaller private distribution locations that I know residents have signed up, but no, there's no one large central site.
Okay. That's a flaw. Thank you.
Yeah.
All right. Jill?
Thank you. So I want to reiterate again, because I know you said that it should not be addressed to the doctor. So I'm not really sure who we should address.
No, go right ahead, restate.
Yeah, I just want to reiterate the fact that a lot of our seniors do not have support, do not have internet, are waiting patiently on the phone for hours, trying to connect with people. And I'm hoping that NYU and all of our Northwell or all of our, you know, hospitals and the people who are supporting our hospitals hire more people to accommodate the older people who are frustratingly waiting to get a person on the phone. Versus, you know, I know everybody's doing as much as they could, but I am pleading for the people who can fix this problem to hire more people. There's a lot of people out of work. Let's hire more people to answer the phone to help us seniors navigate this very trying situation with the vaccines. And that's the last I'm going to say about it, and I hope somebody addresses it. Thank you.
Thank you, Jill. I'd like to add to what you're saying, because it echoes what you're saying. Some feedback that we got from seniors in advance of tonight's meeting. One says, I live in Bay Ridge and spend 14 hours online and phone to get my appointment in Bensonhurst. Another, I spent, is this the same? I then spent another 14 hours to get appointments for my disabled daughter and wife. They are scheduled next week. Only hours after getting appointments, I now hear on the radio, New York City may run out of supply by then. Can you ask if there's a shortage? Will we be notified? I don't want to have to travel to be told they ran out. Will there be more locations in Bay Ridge? For it is hard to travel. So that was from one constituent. Also, each time I access the state vaccine website, I must re-enter my extensive information all over again. This is cumbersome and frustrating. Am I doing something wrong, or is this how it's set up? Then once you get past the initial sign-in, all of the many sites listed do not show if they have available slots. Again, you must access each one individually and often fill in other forms just to be told there are no slots or vaccines available. Why not only display the sites with availability? It's very difficult for seniors to sign up. Can there be a way to leave a message and have a return call? And then finally, I'm a homebound senior. I would like the vaccine, but all of the locations are outside my home. Is there a special way to set up an appointment with a visiting nurse or pharmacist?
Well, I hopefully wrote down all of them in order. I'll try to get them one by one. But first thing I want to say in terms of like the locations, so the Pfizer COVID-19 vaccine is being distributed directly to hospitals at this time because they have the ultra cold storage capacity that is required for this vaccine. And the Moderna vaccine is being distributed initially to hospitals and fairly qualified health centers and other agencies and organizations that can vaccinate eligible populations. In terms of vaccine supply, again, this is something that we are receiving from the federal government. And like I said earlier, that there are more folk that are eligible to receive it than there is actual supply. And we are doing everything we can to mitigate the long, wait lines on the phone of people calling in, just sharing this frustration and trying to find an appointment slot. And the website that you talked about, that is a state website that you have to fill out. The form is on the state website to show that you are eligible. So that's something we can flag to our state folk as well. And each location does manage their own appointment. So that's why it's not in a view all. So the doctor that was presenting earlier, she did say that it's easier to sometimes call a phone number because you're able to have someone do all of that searching for you in a sense. But on the line, when you're scheduling it, you do have to go to each direct location because each location is managing their own appointment. And the point to homebound seniors, this is something the city is working on and is acknowledging the need for. The mRNA vaccine makes it a little bit hard because unfortunately, like I said earlier, the vaccine can't be just transported and deployed in the way like other vaccines are, because they are mRNA vaccines. So it's not something you could just like pop into your bag and go ahead and just go anywhere it is. There does need to be that, the cooling of it and then the thawing of it to administer it. And we are working on ways to figure out how to meet people where they are. But right now, based on the stability issues with the vaccine, we can't transport them, just like the COVID-19 tests, for example. So again, we're working on all the options and, thinking through the transportation, and hopefully we'll have more to share soon about this. I think I covered all of them. Did I miss any?
In addition, we're going to make sure to try to get some clarity as to the supply and how it might affect existing appointments. And so that particular issue, we'll try to get a response back to you by email, because that is an important point, and we do take that very seriously, to make sure that no one is taken to through all of these steps just to not be able to go through it. So that's an important point, and we'll get that back to you.
Thank you. Marianne Nicolosi.
You ready, Marianne?
Yeah. Let me take my hand down. So I run a home delivered meals program and a senior center, and there are approximately 20,000 people over the age of 65 in Bay Ridge. Bensonhurst probably has about the same amount. You've heard the problem with there being 14 hours of work to get one person an appointment. I think that's a little high. I'm hoping that that's not the case for everybody. We've just been advised by the Department for the Aging that they would like us to switch off from everything else we do to assist people, our seniors, in getting set up for these appointments. The issue that I would like to just bring to your attention is the massive inaccessibility issue here. There's no accessibility because of the digital divide. 80% of seniors over the age, certainly in the 75 plus category, can't access it through the internet at all. Those that can access through the telephone are not really capable of managing 14 hours of telephone waiting. I mean, they're just, and then once you get the appointment, they have to get out of their homes. They have to get to the appointment site. You're supposed to go there with all sorts of forms ready for, they can't print them. It's just, considering that the highest risk population are those over 65, it appears as though the city and the Department of Health has not coordinated a system that will help that particular population. And I know you're talking to DFTA, and I know my staff. I have 7 staff people and 20,000 clients. You know, it's an overwhelming task. I have to agree with, I believe it was Jill. You know, we need more hands on deck to do this.
Thank you. Thank you.
We really need more hands on deck, and whatever advocacy you can do for that would be awesome. And you know, Bay Ridge Center, I know for a fact, we had a board meeting the other day. Our sponsor agency is more than willing for us to be a site. You know, we're 3 blocks away from NYU's, brand new building.
Ambulatory care. Yeah.
Thank you. You know, it can be coordinated so it could work. And I just, to the extent that it can be localized, and we all, this community is very, very strong and very, very senior friendly. You know, we've got lots of restaurants with freezers. Things could be coordinated to make it better. That's all I'm saying. So I'm not asking you to justify the city of New York's inability to do all of this on a dime. I understand that it's a huge lift, but I certainly would appreciate it if you could advocate strongly for some sort of system of making this more accessible to the people who are most endangered by it. Not to mention that they've been stuck in their homes since March.
Thank you.
Thank
We
you for
will.
your comment, and we'll absolutely take it back. And you know, just we were in a really bad place with COVID-19 tests at some point, and that was inaccessible to a lot of folk. I mean, only like a small group of people was able to get them, and we were able to get to a place now where everyone can get access to tests. So hopefully, you know, as you know, everything keeps going, we'll get to that point as well where anyone can just get access to it easily, as getting a flu shot, as getting a COVID-19 test, and all of these horrors will be behind us. So, but thank you for your comments.
Yeah, and that's certainly something the city is going to look into doing in terms of piloting ways that are safe and stable to make vaccines more mobile and going to where our seniors are, where our most vulnerable populations are. So please know that we're, even just to be able to pilot it, that's something we're ready to, and we're moving towards. And we know where our advocates are. Ms. Nicolosi will certainly reach back out to you in terms of, and we've certainly been getting those questions from our elected officials in terms of capacity and what's the potential rate of progress. And so we take very seriously that this is what New Yorkers want us to be able to deliver.
Thank you very much.
So I see David Drain.
Thanks, Josephine. And I want to just reiterate something that Mary Ann said about the technology. And I know that it was mentioned before about how very frustrating it is to go through a particular site, fill out all the forms, check all the boxes, certify all your information is correct, only to discover that there are no available sites, appointments. I was actually late today because I spent an hour and a half with one of our clients trying to help them be able to find an appointment. And even all of the mass sites that I could identify, there were no appointments through March. So I don't know if that's related to the shortage of supply or if there was some other thing that I was doing potentially incorrectly, but that's very deflating to the seniors to see that they can't get access to something for so long into the future when they are now being prioritized. So as a technologist, there's a number of different things I could, spout out to sort of suggest you make changes to, but, even just by, not displaying somebody that doesn't have any appointments is not a horrific task to for people to be able to flag. And there are, everything's done today through databases. So I would just encourage you guys to put some thinking caps on and reflect on the user experience to try to make that be a little bit easier. Because even if we were to start taking on more responsibility to help our clients, we would do it through those applications. And so then we would find ourselves trying to help somebody for an hour and a half, 2 hours, 3 hours, going through each single one until we found something would mean that we couldn't help a lot of people over the course of time. And so it's a real bottleneck that I hope you could find some way to look at a little bit better.
Certainly. And while there may not be appointments now, or it looks like the next appointments are in the future, as we continue to add the capacity and the locations, and as we continue to receive more doses, appointments will open up, even before then. So it's not to say that they have to, it's always forward looking and farther away. As the capacity increases, earlier appointments may become available.
I understand it just means a daily check for folks, and it's just part of how trying to help people who can't do it themselves, how much more difficult that is for us. When we can't, get someone signed up, they can go and do it, and we're kind of done with it. We have to keep helping one person before we can start helping others. It just is a bottleneck. And I'm not suggesting you guys are at fault. I'm just saying that that's a huge area that needs attention.
Thank you.
I agree with that. I agree with that.
Iris, Councilman Brannan is on. He'd like to say a few words.
Hey, can you hear me?
Yes, Councilman, we can hear you.
Cool. Thank you, Josephine. Thank you, guys. I've been listening in as much as I could. I wanted to just chime in on a couple of things. I think the main thing here is that what we're dealing with as far as the vaccines is that there just aren't enough of them yet. And that might be what no one really wants to tell you. I think right now you've got millions of people in New York City who are currently eligible for the vaccine, but we're only getting around 300,000 doses per week. And that's for all of New York State. So the math just obviously doesn't work out there. And that's why you have a lot of folks who are unable to get appointments. Certainly, we've also heard the call for more vaccine locations in Bay Ridge and Dyker Heights. What we've got right now is sort of a chicken and egg scenario, because there are plenty of locations ready to go and people ready, willing, and able to be a vaccine location, but we don't have the vaccine. So if we had more vaccines, we would have more locations. And based on the calls and the emails to my office over the past couple of days, if you call or you go online right now, chances are you're not going to get an appointment until the next round of vaccines arrive and more appointments open up. And so what was just being said, I think this dynamic is only exacerbated by the fact that the website and the hotline sort of withhold that reality of the vaccine scarcity until the end of the registration process. So now that you've spent 3 hours on the phone or you spent 3 hours trying to navigate the online portal, then at the very end, it tells you we don't have any more vaccines, or it doesn't tell you anything, or it wants to send you to the South Bronx when you live in Coney Island. So look, I don't think that anyone should expect that this process is going to be perfect. We're still in the very early days of a massive vaccination distribution. We've never vaccinated on this scale, but I do think that it needs to be more clearly communicated that at this time, everyone who is eligible should not expect a vaccine immediately. Right now, vaccine eligibility does not equal vaccine availability. That said, in the meantime, we're working with the city to try to improve the functionality of the website and the phone line so that you can get on a waiting list for a particular site. So that if you are eligible for a vaccine, but you want to go locally, you should be able to, be put on a waiting list for that site. Sure, it's important that you're given other alternatives, but for a senior or someone who, has trouble traveling, or doesn't have access to a car or public transportation is difficult. Being offered a slot in a different borough is not really helpful. So we're aware of all these challenges. We're pushing the city and the state to be a little bit more clear on the reality of the amount of vaccines that we're just not getting from Washington. But at the same time, we're doing our best to try to get this up and running and make this as smooth as possible. But I think we all need to be patient, and we all just need to be understanding that this is what we're dealing with right now. But certainly my office is always here to help and help everyone navigate the system, and whatever we can do to help to make this easier for folks, that's why we're here. So thank you for having me on.
Iris, you're on mute. I just want to say we have a few people holding their hands raised. Sophie Maheltis from Senator Granardis's office.
Yes, hi, can you hear me?
Yes.
Hi, thank you for all the information. My question was, does the Vaccine Command Center currently have the capacity to connect folks to transportation assistance to their appointment?
That's something they're looking at, and they're trying to also work with programs such as Access-a-Ride to make sure that vaccine appointments qualify for those types of programs. And they're exploring all of the different opportunities with additional transportation partners. I know there are some community-based organizations that are already offering that because of their individual organizational capacity. And we're trying to see if there's a way to coalesce, to bring that information together to make it as accessible as possible, particularly for those with the greatest needs.
Thank you.
But we'll make sure to touch base back with your office about that particular issue.
Thank you.
Iris, we have Todd Fliedner.
So one other group I would like to lobby for as a priority group is our home delivered meals deliverers. Our home delivered meal staff has worked throughout the pandemic, making sure our homebound clients got a hot meal every day. We did uninterrupted service throughout the height of the pandemic. We are finding it hard for our deliverers to get the vaccine. And they are out there every day, as other essential workers are, exposing themselves, to harm. And I just think when groups are considered for priority vaccination, a great majority of our staff of home delivered meals deliverers and drivers are older and have some health conditions. So, this is something I think across the board that, this needs to be talked about, and our drivers are coming to us. We tell them we're lobbying for you. We GIFT with as many agencies as we can, but it still really hasn't been addressed. And I would really love to see that issue addressed, because these are the people that are making sure our older adults are fed every day.
Certainly, and we do encourage additional questions about potential nuances within the general categories that have already been made eligible. Even just today, we got not particularly to home delivery service providers, but also commercial food delivery folks, our general delivery people for that, as well as employees of organizations that provide, for example, domestic violence programming as well. So we do ask that you please make sure that we get those questions. We're trying to work with our partners at the state level, because their interpretation of eligibility criteria are driving this. And so we want to make sure that we can advocate for those subcategories to try to expand eligibility. And hopefully the supply will then continue to meet that.
Who would we send that to?
I know there's no chat box, and I can give you my email address. It's my last name and my first initial. So it's D as in David, OHERTYT, Doherty T, at nychhc.org.
Thank you.
Thank you. Iris, I know we've had a member of the public patiently waiting to ask a question. I think we're through with committee members. So Lucia, I know you've had your hand raised for some time. Lucia, you're on mute.
Okay, I'm so sorry. Thank you so much. I'm very, very informed by this meeting. I want to thank everybody. My concern is my daughter tested positive for COVID-19 in November. She is expected to get the shot, her first shot, next week. My concern is she getting the shot too soon? And if anything, what would be the consequences or benefits of getting it before what everybody's saying in the 90 days?
I can answer that question.
Thank you so much, Doctor.
Yeah, hi. This is Dr. Parmesaran from NYU. So the CDC guidance is that most people are expected, if you have had COVID-19 illness, for example, and you've recovered from it, most people are expected to be immune for about 3 months. Now, what they're suggesting is you could wait until 3 months, or you could wait until you feel better and your quarantine period is over and take the vaccine. How they're phrasing it is because the trials actually, even though they weren't trying to recruit people with past COVID-19 illness, but they landed up having participants who had antibodies to COVID. And those participants did fine when they got the vaccine. So your daughter had the illness in November, she's reasonably far out. She should do fine with the vaccine. I've heard of some other doctors and healthcare workers who've had COVID-19 illness. They did okay. Kelly Minus, I don't know if she's still on. I'll let her say a few words on this. But there should be no problems with getting the vaccine now if she was offered.
Yes, thank you so much.
Right. Iris, we have Miles Davis from NYU has his hand raised.
Okay, Miles?
Can you hear me?
Yes.
Okay. Just maybe 2 or 3 very quick things. Number one, about 5 o'clock this morning, just to strengthen some of the points that people made about not going unless you have an appointment. On the internet, some media postings about 5 o'clock, there was a story that there were 400 doses available on 58th Street. And hundreds of people responded to 58th Street. It was the worst traffic blockage I've seen in a long time. People were driving on the wrong way of the street to pass other drivers to get there. And then there was a very large police response. So again, just to reiterate what everybody's been saying tonight, you need an appointment. Secondly, is that for the sake of NYU, because this was brought to my attention within the last few days also about people not having access to the internet and not texting, okay? And my 97-year-old dad doesn't have a computer and he doesn't text, he doesn't have an iPhone. But he is an NYU patient, and right now I'm talking about NYU patients only. A lot of people, NYU is making their appointments through MyChart and then sending texts to patients inviting them to set up an appointment. Okay, and it's been working pretty good, and people who are 90 years old have been doing it, but as was pointed out tonight, a lot of people can't do that. So I've been working with NYU a little bit during today to see if there's a way that for NYU patients at the moment, and there's a lot of them in Bay Ridge, who don't have internet access, that maybe we can set something up that they can call and have an appointment set up for them when they do call. So we just started working on that today. And the last question I have is maybe for people from the city. There's been some talk that immunocompromised patients can also get the vaccine a little bit early. And my question was, does that apply to HIV patients? Are they considered immunocompromised, and would that give them access to the vaccine a little bit earlier than maybe healthy people? Anybody from the city like to jump in on that?
So I was just wondering if the doctor wants to actually answer the question about the immunocompromised for getting the vaccine.
I can't, I don't think the city received any guidance on what consists of immunocompromised, right? It's a huge bucket of people. It can range from anyone with a rheumatological condition to HIV. In terms of HIV alone, yes, their immune responses are different from the general population. So they would come under the category of immunocompromised if their certain, counts, their cell counts are lower, for example. And they were included, well-controlled HIV was included. The trial participants had that condition and they did fine. So I don't think the city has guidance, about prioritizing those with HIV or prioritizing those with cancer or other conditions. They're all grouped together. So I'm not really sure what's happening on the field. They may get it under that category, but I have personally had a lot of my patients call me about this particular clause. And if they are able to make an appointment and their HIV is very well controlled, I've encouraged them to go and fill up the the site's forms and try to get an appointment. And most of them circle back saying there's nothing available. So there's no good answer to your question.
Yeah, and I also just want to add that folks should discuss with your healthcare provider whether getting the vaccine is the right decision based on your medical history when you have nuances like that.
Thank you. Iris, we just, I want to be cognizant of time. We have one more public member with a question. Maybe we could, that's Jeffrey.
Yeah, I just have a related question. I guess I'm going to ask my doctor. But if you're going under radiation therapy, should you get a COVID vaccination, or would there be any sort of conflict or on that?
Yeah, again, on our end, we would want you to talk to your healthcare provider because, whatever your medical history at large might encompass.
That's what I thought. Thank you. Have a good evening.
We have one more hand. I'm sorry, I didn't see it. Ian Yanza from Assemblyman Mike Tanousis' office.
Hi, can you see me?
Yes.
Yes.
Hi, how's everyone doing? I just wanted to introduce myself. It's my first time attending this meeting, and I just wanted to let everyone know that anyone in our district who needs any sort of assistance, I'll be the contact at Michael Tanousis' office. And we've had plenty of people calling up trying to get some assistance with appointments, and we've been trying to help them as we could. So I'd be glad to try and help anyone who may need it in our district, and I can leave my contact information in the chat. Is there a chat feature
Yeah,
here,
there's
actually?
not a chat for some reason. I
Okay.
don't know why. I have to fix
Okay.
that, but I will email it to the group that's here. Thank
Okay.
you.
Thank
Okay.
you so much. I appreciate that.
You're
Thank
welcome.
you.
Okay, Iris.
Okay, well, I want to thank everyone, our presenters, everyone who came, our board members and members of the community. I do hope that you found this helpful. There's a lot of information, and I think really what we want now is more vaccines, but we know we've got some terrific people out there to help us as we do, and I appreciate your taking our questions and recommendations as we move forward in this process to make it make it a bit easier on people because they're, this last week or so has been really tough. So again, thank you. Thank you for coming this evening. And with that, I'd like to adjourn the meeting. It is 8:36.
Thank you all.
Okay, good.